evening, everyone. Welcome to Healthline. I am Gregory Zarian, and I am flying solo tonight because Suzanne Watley is on holiday with her daughters. Hi, Suzanne, thinking of you. Okay, so when we were kids, we were always told by our parents to never play with kitchen utensils and knives in the house. Please pay attention to your parents because guess what? A butter knife was the talk of conversation internationally all over the world last week due to a gentleman who was 63. He decided to take surgical matters into his own hand and actually tried to take out his own hernia. When police actually found him, he was laying in a pool of blood, and the most disturbing part of this was the handle was sticking out of his stomach. As they were waiting for paramedics, he decided to pull out the handle and actually try to cauterize his own surgery, his own personal surgery with a cigarette. Never attempt anything like that at home. The butter knife was a conversation internationally. The reason why it lands right here on Healthline is because there is a quote, and the quote is, "It is absolutely impossible for someone to fix their own hernia." That is a quote from Glendale Adventist's very own Sam Carvajal, who is one of our favorite surgeons here, and he's also one of the pioneers of the SILS procedure, which could have taken care of the hernia just like that. Sitting with me is Dr. Sam Carvajal. Hi, Dr. Sam.
Hi, how are you doing?
How are you?
Just fine, thank you.
You've been the name that people have been talking about all over the world within the past week. I Googled it, 30 pages and going, and your quote all over the world.
Yeah, it's gone viral so much so that I actually feel sick from it.
Do you feel sick from it? We're talking Australia, Asia, Vancouver, even Boston Barstools, and one blog said, "I can't believe it's not better." So everyone is taking this and running. And it's all about a butter knife and a simple procedure that you do called SILS that could have handled this hernia just like that.
Yeah, the irony of it is I will bet that the incision that he would have ended up with if we had fixed his operation in this new technique of single incision laparoscopic surgery would have probably been smaller than the incision that he tried to make on himself. And we don't use cigarette butts afterwards.
No, and I mean, for anybody at home that wants to MacGyver their own surgery, please don't. You know, we're going to spend a lot of time with you tonight, Sam, but ABC did such a wonderful piece on you. Let's go to ABC and see all the great things they have to say about you. And when we come back, we're actually going to discuss what a hernia is. And I'm going to repeat this again. Do not try anything medical on your own at all. We'll see you afterwards.
Imagine having part of your colon removed through your belly button and then going home the next day. No scars. We'll tell you about single incision laparoscopic surgery coming up on Eyewitness News.
Before you hit the road or head for the airport, there are a few tips that can help you stay healthy while you travel.
Health specialist Denise Dodor runs them down, but first, amazing advances in surgery that are giving patients incredible results and a quicker recovery.
Yeah, some experts say this could change everything. Surgery through your belly button? Think of the advantages. No scar you can see, only one incision, but is it practical? One local surgeon says it's the way abdominal surgery should be done.
On the morning of her colon surgery, Ida Irinosian is looking forward to a procedure that'll get her back on her feet the next day.
I have a full-time job, 3 kids, so I want to recover faster than, in the other way.
A colonoscopy revealed a large, non-cancerous polyp, but she needs 6 inches of her colon removed. The standard operation would mean 4 days in the hospital and up to a month to recover. Instead, she opted for single incision laparoscopic surgery, or SILS. Dr. Sam Carvajal at Glendale Adventist Medical Center has performed 900 of these. Instead of 2 or 3 incisions, he just does 1.
We can do all forms of laparoscopic surgery through single incision laparoscopic surgery, including hernias when we're working in the muscles in that particular situations, or over in the stomach where we're removing parts of it, or as in today when we removed a part of the colon.
In this animation provided by Covidian, you see a tiny incision in the belly button. Inserting the SILS port allows Dr. Carvajal the ability to snake in various tools at the same time. The wires cross and bend, allowing the surgeon to maneuver through a patient's abdomen.
We also can remove the appendix and the gallbladder and parts of the small bowel, and we can treat tumors inside the liver.
The next day, Ida went home, and she expects to return to work in about a week.
Patients truly do remarkably better, and they have less pain, are able to go back to work sooner. We've done this on many lawyers and doctors who go back to work within a day or 2.
Dr. Carvajal says sills is also a great option for elderly or other patients not healthy enough to undergo conventional surgery. Ida is looking forward to a speedy recovery. As you can see in this post-op picture, she doesn't even have a scar.
Dr. Carvajal told me that I can walk right away, and I'm going to tell him to send me home.
And Dr. Carvajal says most patients don't take more than an over-the-counter pain reliever during recovery. He says the risk of infection is the same as any other laparoscopic surgery. If you'd like to get more information on the sills procedure, log on to our website at abc7.com. Click on Health on the left-hand side.
Welcome back. Tonight we're talking about the butter knife that was talked about all over the world, and especially the gentleman that lived right here in Glendale that tried to repair his own hernia. I'm joined with Glendale Adventist's very own Sam Carvajal. Sam, what is a hernia?
In the simplest term, a hernia is just a hole in the abdominal wall where the contents inside the abdomen are able to push out past the muscles. These can be a hernia that you're born with, which is one of the more common ones, or ones that can happen from heavy lifting. When they happen after an operation, we call those incisional hernias, and the most common location for hernias are in the inguinal or groin area.
People are born with hernias?
Yeah.
I'd never heard of that.
Absolutely. It's one of the more common causes of hernias, something that you're actually born with.
Now, men and women?
Men and women have hernias. Certain kind of hernias are found more frequently in women, but in general, most hernias are found in men.
What types of hernias are there? I know there's two types.
Well, there's again a whole host of different kinds of hernias. There are even some type of hernias which are called sports hernias or atypical kind of hernias, and we don't really want to spend a lot of time with that since what most people see as a bulge in their abdomen, it's pretty clear what that diagnosis is.
Because most people, when they think of hernia, they think of don't lift something too heavy or be careful when you're working out and stuff like that. Is that
That's correct.
Fair to say?
Absolutely.
What are the signs and symptoms of hernias? Other than the bulge?
Well, the bulge is the most common, but when people are straining, they can often have pain. They can, even in the last stages of hernias where it truly sort of becomes an emergency, the intestine can actually come out and get cut off or strangulated and can actually die, and that becomes an absolute medical emergency.
Now, is there an age that a hernia can start? Like, can an infant even get a hernia?
Yeah, many infants are actually born with hernias, and then that are present and noticeable right after birth, and they can present even into the end stages of life. I have repaired many 90-year-old men who had the kind of hernia that they were actually born with, and over those 95 years, they have this hernia has been just getting larger and larger until it finally caused the symptoms that forced us to do surgery.
So we're going to talk about cells, but what type of surgeries are still performed in regards to hernia surgeries and procedures, Sam?
The vast majority of surgeons across the United States will do an operation where they make a 2 to 3 inch incision over the hernia, and they'll often sew in a piece of plastic material, or plastic mesh as we'll often refer to it, in place. This is a very good operation. It's been done for a long period of time, but it has a lot of really big downsides, including a lot of pain, a lot of difficulty recovering, and there is actually a fair amount of recurrence of the hernia using this technique. And then there have been techniques over the last 20 years where we have made 3 small incisions, what we call standard laparoscopic hernia repair, and maybe 10% of surgeons across the United States are able to do this. And over the last 2.5 years, here at Glendale Adventist Medical Center, we did the very first single incision laparoscopic surgery where instead of 3 incisions, we make 1 small incision inside the belly button, which is cosmetically undetectable. But even more importantly, the fact that it's all in 1 little tiny incision means that patients hurt significantly less.
And that's known as sills. We are going to spend more time with Dr. Carvajal talking about sills. Don't go away.
In single incision laparoscopic surgery, I make a single incision within the belly button so that there's nothing that can be seen after the operation.
There were no stitches. In terms of pain, it was minimal.
What he's doing is 1 incision inside the belly button, which nobody can see.
Patients are able to recover quicker from the operation. They're able to go back to work.
One of the reasons we chose sills is because I have a 4-month-old baby.
My name is Sam Carvajal, and I'm one of the general surgeons here at Glendale Adventist Medical Center.
Dr. Carvajal was great. He made me feel very comfortable.
He was very comforting, and the procedure was awesome. He did a great job.
The majority of the patients that come to my office who require abdominal surgery are candidates for single incision laparoscopic surgery. And in fact, 95% of the laparoscopic operations that I perform are single incision laparoscopic surgeries. I'm using this technique to not only remove gallbladders and the appendix, but we're able to also fix inguinal hernias, remove parts of livers, treat the liver for cancers. All of this is done without any scar. The advantages to patients are not only that cosmetically you cannot tell you've had an operation afterwards, but more importantly, they're able to get back to their actual life.
You can go back to your family, to your work.
We formed a training program here at Glendale Adventist Medical Center. I have no doubt that within 5 years this operation will be available all over the nation, but it's currently available now at Glendale Adventist Medical Center.
Welcome back to Healthline. Tonight we were talking about the butter knife that was talked about internationally recently, about a gentleman right here in Glendale that tried to repair his own hernia. Joining me is Dr. Sam Carvajal, world-renowned surgeon and the go-to guy with the SILS procedure. Sam, hernias and SILS. Talk to me. How does someone take those instruments and repair a hernia surgery instead of using this?
Well, I promise you we don't use any butter knives during the operation, but what we actually do is just make a small little incision inside the belly button. And then I get behind the muscles without actually getting inside the abdomen and create a space in there where I'm going to go ahead and put in this particular device. This is a device that's made by Covidien. It's known as the SILS port. And this little device is made of foam and can squeeze down to even quite a small little hole. And through this, I'm able to go ahead and put instruments inside that space, and these instruments are able to bend, and I'm able to clean up the space, bring the hernia back to where it needs to be. Once that's all been done, then I'll go ahead and place this piece of plastic inside the abdomen, and this blocks that hole in the abdomen so that nothing from inside can get to the outside, and that repairs the hernia. And that takes only about 15 minutes to do, and again, we can do it through an incision that's about 12 millimeters.
Okay, so that goes through that? So
we have another port that's a little bigger.
Where that will go through?
That will actually fit through.
So this is what SILS does. What about other procedures? When earlier we were talking about going through the stomach wall and everything, and you don't do that with SILS, what would someone do on a standard hernia surgery as per the easy, efficient way that SILS would be done?
Well, instead of making the small little incision, they're making large incisions, and then they're taking this piece of plastic and they're actually physically suturing it to the muscles. That's the reason why it hurts so bad afterwards.
What is the healing time in regards to this procedure?
Well, we've done this on many surgeons and lawyers and other people with different professions who are back to work even within a few days. But what's unique is when I see these patients in the office a week later, most patients who have standard hernia repair are bent over and having a difficult time walking, and they have 2 or 3 more weeks of healing before they're able to get back to work. Where the patients who undergo the SILS hernia repair are able to come to my office like nothing's done. Many people say, hey, I was out and watching movies or going out to dinner even several days before, and I'm already back at work, and I didn't take any pain medications afterwards, which literally over half of our patients don't take pain medications.
But Sam, they're both hernia surgeries. Why is the standard so much more painful than this?
Well, part because of the size of the incision,
okay,
in part because the piece of plastic is sewn to the muscles. In the SILS operation, we're not cutting any muscles, we're not suturing to any muscles. We're working in spaces that already exist to be able to deliver this piece of plastic. And because of that, it does not hurt very much.
Is that where most surgeries hurt the way they do, because they're actually going through muscle and making deeper incisions?
The most common source of pain is when we're cutting through muscles, and that's why when we make large incisions in abdomens to get to inside the abdomen, it hurts so bad.
Thank you, Dr. Sam. When we come back, we're going to talk about pain and what led this gentleman to want to repair his own hernia. Don't go away.
Hi, my name is Frank Sontag, and this is my story. About 6 months ago, I was running in my canyon and I felt kind of something let go.
I was supposed to have stereotypical hernia surgery. I had a double hernia.
About 2 weeks before my scheduled surgery, Mari Abrams, who works at Glendale Adventist, heard me mention on the radio program here that I was having the surgery. And so she sent me an email and she said that there's this new procedure that Dr. Carvajal does called SILS, and sent me a video, and I was blown away.
In single incision laparoscopic surgery, I make a single incision within the belly button so that there's nothing that can be seen after the operation.
I contacted Dr. Carvajal and had a consultation with him, and he reiterated he could do this surgery without the incision. A little more than 2 weeks ago, had the surgery on June 17th. When I met Dr. Carvajal, I didn't know what to expect. I instantly liked him because he obviously really loves what he does. And so I felt instantly like, okay, that's what I want to do. I'm really looking forward to seeing what happens.
I put a device through the belly button called a SILS port. And it's through this that I initially put a telescope, and I'm able to see what's inside the abdomen on a screen at the top of the patient. I'm able to bend these instruments where I need them to go to perform the operation.
I was up the next day and was just blown away.
Patients are able to recover quicker from the operation, and they're able to get back to their actual life.
If you thought you were in pain after the first laparoscopic operation, the open repair would have been, you'd be walking in here bent over.
When can I start running?
You can start running now. I have no problems with that. There's no question that 10 years from now, this will be everywhere. I mean, this will be widely available.
I was actually back to work Monday. Surgery was Friday, back to work Monday. I'm running again. It's just amazing because some of my coworkers, they still can't believe I'm back to work. I'm just grateful, and it's just, it's pretty profound, and any way I can get the word out, off air, on air, I'm telling people about Glendale Adventist and Dr. Carvajal and SILS.
Welcome back to tonight's episode on hernias and pain, and we were actually talking about a gentleman who tried to repair his own hernia with a butter knife. But we just saw a great story on Frank Sontag from KLOS right here in Los Angeles, who had his procedure on a Friday, was back to living his life on Monday, and being an avid runner as well. Frank, I understand it about wanting to get your shoes back on and going for a run. Joining Dr. Sam Carvajal, world-renowned surgeon, is Scott Robertson, the director of GADS, Glendale Adventist Alcohol and Drug Services. Welcome, Scott.
Greg, good to see you again.
Gonna go to Dr. Carvajal real quick. Pain and a hernia. Would pain that bad really want to make someone try to repair their own hernia?
Well, clearly hernias can get so large and so painful that somebody may feel desperate, but clearly there is a huge amount of psychosis going on in somebody believing that they can actually achieve a hernia repair by themselves. It just can't happen. And so there's a lot of serious psychological issues in this particular story. But hernias do hurt, and with the right amount of psychosis, you can imagine somebody attempting to do this.
Because it also stated in all the articles that he was actually put on a psychiatric watch. Scott, pain, addiction, what do you feel someone is actually suffering from in regards to wanting to repair their own hernia, and again, butter knife?
Well, as Dr. Carvajal has said, clearly there's something else psychotic going on in that kind of behavior. And the thing that's difficult for many people to understand about mental illness is the person may be responding to stimulus that the rest of us can't understand. Hallucinations, they could be auditory, they could be visual. We don't know what state the individual is in, so we can just project that he was greatly disturbed. And the law in California provides that we can place a person on a hold when they pose a threat to themselves or to others. And clearly this gentleman posed an imminent threat to himself to take an instrument like a butter knife to a hernia And I was particularly horrified at the thought that he was using a dirty cigarette
to cauterize.
Cauterizer. One story I read said that he was putting the cigarette out in his incision.
Waiting for the ambulance. You said mental illness.
Yes.
Is this mental illness, or is it someone that is suffering from so much pain that they want the pain to stop?
Well, yet physical pain is a thing that really is a vital sign in and of itself. So at Glendale Adventist Medical Center, all of our patients, whether inpatient or outpatient, are evaluated for pain. And the responses we see to pain, this is atypical. The responses we see to pain are typically not self-destructive actions as this man pursued, but typically self-preserving practices. Recoiling in or curling up into oneself, seeking protection, seeking other help, seeking medications. Those are behaviors that we see typical for people in acute pain.
So then, Dr. Carville, how do you then treat patients that are in so much pain they want it to stop?
Well, we operate on them as soon as possible. We, of course, give them appropriate pain medications until the operation can be done. But often, just with the repair of the hernia, as in this gentleman, he would have been much better, gone home the same day, if not the next day, depending on what time we did the operation, and he certainly wouldn't be on the psychiatric hold right now.
What do you think he actually did to himself physically by, as I said earlier, MacGyvering into his own stomach to relieve the pain? What do you think he did?
Well, hopefully he only injured his abdominal wall in doing this, but certainly it's possible that in stabbing the knife into his abdomen, they actually injured a piece of intestine, which means that he would have to be rushed off to surgery to have a piece of the intestine removed. And I can promise you this, his pain after this attempt at self-hernia repair was much greater than it was before.
Well, I kind of hope it made him quit smoking, though, because, you know, that's just at least kill two birds with one stone. Scott, really quickly, if somebody is suffering from this much pain, do they call their doctor for a prescription? Do they reach out to GADS and say, you know what, I'm really hurting and I feel like I'm getting addicted to something? What do you suggest?
Two subjects. A person, in that much pain needs to reach out for medical attention through an emergency department, through their own provider, through their own doctor's office. If it's that acute a pain, though, that's dial 911. That's go to the hospital.
And the last one?
A person who is concerned about taking pain medications can call us, talk to us about it. There are people who take pain medications legitimately who still could develop a withdrawal syndrome that's classically associated with addiction. And that's not necessarily addiction. Withdrawal syndrome by itself does not define a dependency illness. We can help them to clarify that at GADS.
Thank you, Scott. Don't go away. Final thoughts from Dr. Sam Carvajal and Scott Robertson from GADS. And again, please put the butter knives away.
Hi, my name is Dr. Sam Carvajal, and I'm here to give you a health tip on what to do when you've been diagnosed with a hernia. A hernia is a bulging that happens in the abdominal wall, classically in the groin area where we call it an inguinal hernia. This hole in the abdominal wall allows the contents inside the abdomen to push out and cause discomfort. Occasionally, even the intestines can get locked up in this position, and that becomes an absolute emergency. For years, we've been repairing this through large incisions in the groin, which are very painful and difficult to recover from. But nowadays, there is a brand new operation that we call single incision laparoscopic surgery, where we make a single incision inside the belly button, and using a telescope and very tiny bendable instruments, we're able to put a plastic screen inside the abdomen to block the hole and repair the hernia. And in this technique, you have far less pain, a scar that cannot even be detected, and a wonderful and quick return back to work.
Hi, are you a member of Facebook? You know, I am, because I like to know all that my friends and family are doing. Wait, did you know that Healthline has its very own Facebook page? All you got to do is go to Facebook, type in Healthline, find us, click like, and become part of the conversation about health, lifestyle, and the community. We post links, health tips, suggestions from you, the community, about what you do to lose weight, de-stress, have a happy, healthy lifestyle. Okay, once again, all you gotta do is go to Facebook, type in Healthline, and become part of the conversation. Hold on. Okay, somebody just posted that if you drink an 8-ounce glass of warm water with lemon, it starts to invigorate your metabolism. Oh, along with jumping up and down for 60 seconds first thing in the morning. Okay, you know what? I've got to pass this on. Become part of the Healthline conversation. We will see you on Facebook. Welcome to our wrap-up tonight. We've been talking about the butter knife that was discussed all over the world about a gentleman that tried to repair his own hernia. As I've said throughout the entire episode, do not do anything surgically on your own. That's why we have doctors. The conversation of the butter knife landed right here in Glendale because a quote from our very own Dr. Sam Carvajal was used. It is absolutely impossible for someone to fix their own hernia. Quote unquote, Dr. Sam Carvajal, Glendale Adventist Medical Center. Joining Dr. Carvajal is Scott Robertson from Glendale Adventist Alcohol and Drug Services. Sam, why would someone choose a Sills procedure as per a standard hernia operation?
From that decision standpoint, a patient's going to obviously want their surgeon to do whatever they feel most comfortable with. At the same time, there's really no reason why anybody would choose a standard hernia repair as long as the single incision laparoscopic hernia repair is available. It's so far superior as compared to standard surgery. And the only question is why aren't more surgeons doing this? And I have no doubt that at some time in the future that these operations will be available all over the United States. But right now it's available only in a few places, one of them being Glendale Adventist Medical Center.
And can I brag about you? That people come from all over the world to train under your guidance, which is extremely inspiring. So if any of you are suffering from anything hernia, he's right here in Glendale. Scott, in regards to someone in pain and someone actually trying to carve out the pain, what do you suggest?
Anyone who's in that sort of acute pain needs immediate medical attention, whether it's an emergency room, it's a 911 call, or a visit to their doctor's office.
Thank you, Scott. Dr. Sam, why would someone choose Sills? What is your one great thought about Sills other than time and efficiency?
It's really quite simple. People get their life back much quicker than in standard surgery.
Dr. Carvajal, how can people find you?
They can go to Glendale Adventist's website at glendaleadventist.com.
Scott Robertson, in regards to pain, what is your final thought in regards to pain and anyone suffering, as you said earlier, from acute pain?
Acute pain, reach out for medical attention, local resources as quickly as someone can. And a person who's taken pain medications and they have a concern that they've gone too far, they can come to Glendale Adventist Alcohol and Drug Services, call us, find us on the hospital's website, and we'll be happy to help them sort through what's pain medication and what could be a drug problem.
Gentlemen, it was an absolute pleasure. Thank you. Thank you for joining me tonight on my solo flying show. Remember, the most important thing you have is your health. So be it a hernia or pain, have a conversation about it, because if you talk about it, you're not going to take matters into your own hands. Have a great night, and we will see you next time.